Welcome to this dog first aid video. It's all about bleeding and infection control. Before we start, now is a good time to hit the pause button, grab a pen and paper, and of course a cup of tea or coffee. When you're ready, we'll begin. Please click the subscribe button below this video if you would like to see more related videos.
Bleeding can be either internal or external. Internal bleeding is almost impossible to detect, and there is no first aid, it needs urgent intervention. It is likely that first signs and symptoms of internal bleeding is the dog going into shock. Only a vet can treat internal bleeding. To get an indication of internal bleeding, check for these visible signs. The dog's gums are pale. The dog's legs, ears, and/or tail feels cool. The dog is exceptionally excited or the opposite, unusually subdued. If the dog displays any of these signs, seek veterinary help immediately. It is important to understand that a dog losing blood as little as 2 teaspoons per pound of body weight is enough to cause a dog to go into shock. External bleeding is more obvious because the blood exits from a tissue wound. No matter whether it is a minor or major bleed, it needs to be stopped. Minor bleeds tend to clog and stop themselves very quickly, whereas a major bleed can be more difficult.
When we consider the 3 types of veins, capillary, venous and arterial, we can understand the types of bleeding. An abrasion or friction wound could cover a large area and bleed quickly, flooding the area with blood from capillary veins, yet stop quickly. A venous bleed, coming from a vein, is more likely to flow out, whereas an arterial bleed coming from an artery is likely to pump out, to the rhythm of the heartbeat. The stronger the heartbeat, the more powerful the bleed and greater blood loss. Blood pumping from an artery is likely to be bright red because it is oxygenated as it is pumped from the heart. Blood pouring from a vein is likely to be darker red because it is deoxygenated and returning to the heart for oxygen. It is more difficult to stop an arterial bleed.
Direct pressure is by far the best method. Trained and experienced people may choose to use a tourniquet, but these are strictly for experienced personnel. For direct pressure, you will need a clean cloth or gauze. A sanitary towel is perfect, even a baby's nappy. Whatever you have at hand, place it directly over the wound, applying firm but gentle pressure. The idea is to allow the blood to clot. It is important not to disturb the clotting process, so don't lift the cloth to check. If blood does soak through, do not remove it, simply place a fresh one on top of the old one and continue to apply pressure. If you have no clean cloths available, a bare hand or finger will still work to help stop the bleeding. Something is better than nothing. It may be that the dog has multiple bleeding injuries. You will need to assess the dog and prioritize the bleeds that need the most urgent treatment. If the blood is pumping out, this is an arterial bleed and is your top priority. If the blood is pouring out, this is a venous bleed and is your next priority. If the blood has puddled in an area but not continuing to bleed, it is likely to be a capillary bleed, perhaps a friction wound, and your least priority. In the case of multiple bleeds, compress the priority wound and secure the compress in with bandages or gauze, tie or tape it and move to the next one.
Another option to help stop a bleed is elevation of the bleeding limb. New guidelines suggest that elevation may not be as effective as we once thought, and there is no evidence that elevating a wound stops bleeding. However, if a wound on the leg or foot is bleeding severely, there is no harm in gently elevating the leg until the wound is higher than the heart. It may work because the action allows gravity to reduce blood pressure near the wound and may slow the bleeding. It may well work, no harm if it doesn't. It could be argued that elevation may work better in bigger dogs, especially those with long legs, because there is a longer distance between the injury site and the heart. Elevation should always be used in conjunction with direct pressure, using compression and bandages for maximum effectiveness.
What if bleeding continues after compression? If bleeding continues after applying direct pressure on the wound itself, you should apply pressure to the artery that supplies blood to the injury. If the injury is on the front leg, apply pressure to the brachial artery. This is found in the dog's armpit area, inside the upper front leg. If the injury is on the back leg, apply pressure to the femoral artery. This is in the groin, high up in the inner thigh close to the stomach area. If the injury is on the tail, apply pressure to the caudal artery. This is at the base of the tail. Continue applying direct pressure whilst on the journey to the vet.
Let's look at a scenario. A dog is laying in a pool of blood. Remember Dr. ABC. D for danger, R for response, A for airway, B for breathing, C for CPR, call for help. As you approach the dog, wear surgical gloves if you have them to prevent cross-infection. Always check for danger, protect yourself from being bitten. Muzzle the dog using a lead, bandage, scarf, belt, etc. so that you are as safe as possible. Before the muzzle, always check the airway to ensure there is no choking hazard. Pull out the tongue whilst doing so. Can you feel any breath? Replace the tongue. Then put the muzzle on. Locate the bleeding. Is it pumping out or flowing? If it is pumping, it will be an arterial bleed. If it is flowing, it will be a venous bleed. Arterial will be more difficult to stop and take longer. Apply pressure to stop the bleed. Use a sterile swab, panty liner, sanitary towel etc. to place on the wound itself and apply firm pressure. You will have two lots of pressure, the artery or vein and the wound. Maintain that pressure for a few minutes, at least 5. Never lift the swab or pad to see if it is still bleeding, as this will dislodge the essential clotting. If blood fills the pad, simply add another on top. If that fills with blood, remove just the top one and replace with a clean one, but apply even more pressure. Direct pressure is the key.
If there are other wounds that need attention, tie a bandage around the first wound to secure the swab. Maintain pressure but ensure you can slide 2 fingers under the bandage to allow for circulation. If it is too tight, it will cause other problems, although it must be tight enough to stem the bleeding. Waste no time in getting to a vet if it is an arterial bleed. If you are considering using a tourniquet to stop bleeding, this involves tying a tight strip, belt, cloth or piece of cord around the dog's leg above the bleeding wound, and pulling it tight. Tourniquets do generally stop bleeding, but you must be mindful that they also cut off the blood supply to healthy tissue and can cause quite severe pain as well as major damage to the leg. Only use a tourniquet if it is life-threatening. That means only if there is bright red arterial blood pumping out of the wound. Once you have tightened the tourniquet to the point where the wound has stopped bleeding, you need to release the tourniquet after 20 minutes for around 15 seconds. This will allow blood to flow to the rest of the leg. Repeat this action every 20 minutes. Always remember, the use of a tourniquet may result in permanent damage or amputation of the leg. Infection control is crucial. When possible, wear medical gloves. If gloves are not available, use wipes or saline to ensure your hands are clean to reduce the risk of cross-contamination. Just before we end this video, let's take a look at infection control. If you are out walking a dog, you may not be carrying gloves, hand sanitizer and saline pods, but it is a good idea to do so, even small packs in a bum bag. Put the gloves on as you approach the dog and assess the scene with the Dr. ABC protocol. If you don't have gloves, hopefully you have hand sanitizer. If not, do you have drinking water? If you have nothing to clean your hands, don't let it stop you from trying to stop a bleed. Some people will say, you can treat infection, but you can't treat a dead dog. If you have saline or drinking water, clean the wound. Don't put hand sanitizer in a dog's wound.
This is the end of this video. I hope you enjoyed it. If you would like to see more videos like it, please subscribe by clicking the button below, and if you would like to be notified of new videos, please click on the bell button below this video. Thank you.